Hypertension. So before coming to the management of hypertension, let's discuss different classes of antihypertensive drugs, right? So there's a particular pattern for the antihypertensive drugs, which are triple A, B, C, D. So the first one is ACE inhibitor, that is lisinopril, enalapril, etc. Because pril comes in its end, right? Then comes angiotensin receptor blockers, which are losartan, valsartan, right? Then comes alpha receptor blockers, which are doxazocin, terazosin. Then there's beta receptor blockers, which are metoprolol, labetalol. Calcium channel blockers, that is amlodipine, nicardipine. And finally, diuretics, which are furosemide, it is the most common one. And there comes hydrochlorothiazide, right? Now, if the blood pressure of the patient is 140 divided by 90 at two separate occasions, then we can tell that the patient has hypertension, right? Now let's come to the types of hypertension. So basically there are two types of hypertension. One is primary, one is secondary. Primary is 90 to 95%, and it is idiopathic because its cause is not known, right? And secondary is from 5 to 10%, and it has some cause, right? Like there can be renal problem, some endocrine issues, or any other systemic problem, right? Now let's come to the different stages of hypertension. So if the systolic pressure is from 130 to 139 and the diastolic is from 80 to 89, then it is pre-hypertension, right? If the systolic is from 140 to 159 and the diastolic is from 90 to 99, then it is stage 1 hypertension, right? If the blood pressure is from 160 to 179 and the diastolic pressure is from 100 to 109, then it is stage 2 hypertension, right? Then if the systolic pressure is greater than 180 millimeter of mercury and the diastolic pressure is greater than 110, then we can say that the patient has stage 3 hypertension, right? Now let's talk about hypertension urgency vs hypertension emergency, right? So in hypertension urgency, there is no organ damage. This is the most important one. It is gradually reduces over 24 to 48 hours with oral medication, right? And with hypertension emergency, there is acute organ damage, that is encephalopathy, stroke, myocardial infarction, etc. Now let's discuss the management of hypertension. So for any stage of hypertension, we will advise first of all lifestyle modification, that is avoid salt, oil, walk, exercise. We will tell the patient to reduce his or her weight, avoid smoking, right? Now let's discuss the management of stage 1 hypertension first. So if the age of the patient is less than 55 years, then we will start ACE inhibitor and angiotensin receptor blockers, right? So from ACE inhibitor, there are TAB, Capac, Zestril, or Capril, which is basically captopril, 25 milligram BD. But remember that in case of lung disease or cough, we cannot give captopril or any ACE inhibitor because it enhances cough, right? So if the patient has lung disease or cough, then we will give angiotensin receptor blockers, right? It is tab azide, which is basically losartan 50 milligram OD, right? Now, if the age of the patient is above 55 years, then we will start with calcium channel blocker. That is tab Corsafe, which is basically amlodipine 5 milligram or 10 milligram OD, right? Now let's discuss the management of stage 2 hypertension. So it is managed by combination therapy of ACE inhibitor, ARBs, and calcium channel blockers, right? That is TAB Extra, which consists of 5 milligram of amlodipine and 80 milligram of valsartan. This dose can be doubled also, that is 10 milligram of amlodipine and 160 milligram of valsartan, right? Stage 3 hypertension management now. So it can be either urgency or emergency, right? As we have discussed earlier. So first of all, discussing hypertension urgency. So I will write tab Capec 25 milligram, 2 tablets per oral, right? And when the patient BP comes to 110 divided by 110, then we will discharge the patient and will give tab Triforge, right? Which basically consists of amlodipine, that is calcium channel blocker, Wilzerton, that is ARBs, plus hydrochlorothiazide, which is basically diuretics, right? That is 5 milligram of amlodipine, 80 milligram of Wilzerton, and 12.5 milligram of hydrochlorothiazide, right? Now, during hypertensive emergency, I will manage the patient as follow. That is, in case of brain stroke, I will pass NG tube to the patient and will refer him to tertiary care. In case of decreased vision, I will refer the patient to ophthalmologist. In case of chest pain or angina, I will do ECG of the patient. And if ECG shows ST elevation or depression or T wave inversion, then I will follow ACS protocol, right? Now ACS protocol. So ACS protocol is basically consists of the following medicine, that is tab Escard, which is basically aspirin, 75 milligram, 4 tablets state, which becomes like 300 milligram, right? Then I will write tab Progrel, which is basically clopidogrel, 75 milligram, 4 tablet state, which becomes 300 milligram, right? Then I will write tab NGZ, most common one, that is nitroglycerin, 0.25 milligram, 2 tab sublingual, right? It is placed under the tongue. Now, in case of analgesia, I will write injection Kenze, that is basically opioid analgesic, and I will administer the injection slowly because it causes CNS depression and vomiting. Now, to inhibit vomiting, I will write antiemetic also, right? That is metaclone, which is basically metoclopramide, right?